Hello, good morning, guys. I'm that Pinoy nurse. Welcome to Nursing Informatics, Computer and Nursing. So, what is nursing informatics again? It is the use of computer technology to support nursing, including clinical practice, education, administration, and research, according to HEBDA 1998. And according to American Association 1994, it is also the development and evaluation of application, tools, and processes and structures which assist nurses with the management of data in taking care of patient or supporting practice of nursing. So we already talked about what nursing informatics is in the introduction. So let's talk about the framework of nursing informatics. We have data, information, decision, and knowledge. So what are these? So with data, it is defined as discrete entities that are described objectively without interpretation. Now, this data, as they are interpreted, organized, and structured, they are now called information. Now, the information that has been synthesized or processed so that interrelationships are identified and formalized becomes knowledge. And the knowledge now help or guide the decision, which are the results of which guide the nursing practice. So, with this data, the raw data that is uninterpreted becomes interpreted, organized, and structured into an information. Now, the information becomes identified and formalized and processed, so it becomes a knowledge. This knowledge is used to guide the nursing practice, which helps in the decision making of the nurse. Okay, so computers and nursing. The computer is the most powerful technological tool to transform nursing profession. Prior to the new century, and computers has transformed the nursing paper-based record to computer-based record. So before, nurses were recording the patient's data in paper, and since the dawn of the computer, so the computer now we have computer-based record, or the record of the patients are now transcribed in the computer, being managed and stored in the computer. It is used to manage information in patient care, monitor quality of nursing care, and evaluation outcomes. So first, let us talk about the historical perspective of computers and nursing. So prior to the 1960s is the issue of punch card and teletypewriter. So in this time, the punch card and teletypewriters were used by health practitioners. So in the 1960s, use of computer in healthcare is questioned, but studies on computers in nursing is started. So the introduction of cathode ray tubes, and the development of hospital information system for financial transaction started in this time. So we will talk about it further in the following slide. In 1970s, nurses assisted in the design of HIS, or the health information system, or the hospital information system. So computers are used in financial and management function, and several communities develop management information system. So in the 1980s, nursing informatics is formally accepted as new nursing specialty. So in the 1990s, computer technology became an integral part of the healthcare setting. And in the year 2000, clinical information system became individualized in the electronic patient records. Mobile computing devices were introduced. New technologies were utilized. Internet provided a new means of development, and the Health Insurance Portability and Accountability Act of 1996 was enacted. We talked about the HIPAA in the introduction is protected health information. So it protects the information of the patient so that it cannot be distributed to just anyone. Computers can provide a wide range of activities that save time and help nurses provide quality nursing care. It involves nursing practice, so nursing education, nursing management, and nursing research. So computers can help in these activities. So electronic health record. It is an electronic health record composed of health information regarding an individual patient that exists as part of a complete system designed to provide access to and management of such information. Now, the Healthcare Information and Management System Society is the healthcare industry membership organization exclusively focused on providing global leadership for the optimal use of healthcare information technology and management system for the betterment of healthcare. Okay, so we have the HIMSS is the society or the industry that provides global leadership for the optimal care of healthcare information technology. So, to understand the electronic health record, we have to identify the history perspective of electronic health record. So, we have here the six time periods. So, prior to 1960s, we have computer grew as an industry. So, also in the electronic health record grew during this time. Nursing also made major changes. Computers are used by healthcare facilities for basic business function, such as the punch cards. This is an example of a punch card. It's a piece of stiff paper that can be used to contain digital information presented by the presence or absence of holes in the predefined position. So this was in the 1950s. So we have also a card reader. So card reader is a data input device that reads data from a card-shaped storage medium. So it stores and prepares data for processing, a series of operations on data, especially by a computer to retrieve, transform, or classify information. So using the card, so you slide the card here and then it will process the data or read the data. Also, teletypewriters are used. So it's an electromagnetical typewriter that can be used to send and receive type message from point to point or point to multi-point over a various type of communication channels. So in the 1950s to 1960s, health workers were using teletypewriters to process the information they get from their patient. Then in the 1960s, use of computers has been questioned because computers now are still a new technology at that time. So there are many questions regarding computers and the ethics of using these computers to to manage the information of the client. So nurses station is viewed as a hub of information exchange. So a lot of information is being interchanged in the nurse station. So personal and medical information of the client. So it is a very important process. So a lot of uh, skeptics at that time were thinking of the pros and cons of using computers. So introduction of cathode ray tube or the CRT and online data communication and real-time processing. A high vacuum tube in which cathode rays produce a luminous image on the fluorescence screen used chiefly in television and computer terminals. So the 1960s, so here it started the use of CRT tube, CRT or the cathode ray tube computers. So hospital information system were developed primarily for billing and accounting system. Vendors for of computer system and application the hospital started. So the a system has already been started hospital information system but only for billing and accounting system and computer systems are now started to arrive or to be present in the hospital. In the 1970s, nurses began to see the value of computers in the profession. So documentation of nursing practice, so quality of patient care, repetitive aspect of managing patient care. So they are all using computers to manage this information. So especially in documenting the nursing practice, instead of using paper, they are using computers at this time. Computers are perceived as cost-saving technology HIS further advanced, or the Hospital Information System. So computer-based management information system in public health developed. So before it was only in the billing and the accounting management who used the HIS, but now it further advanced. So different areas in the hospital now use the hospital information system. We have the OPD, pharmacy, so we have the nurses station, accounts, the other departments. So with this computer-based management information system, also in the public, it helped develop to manage the the information for the public. Okay, so at this time, computers were perceived as cost-saving technology because they can better manage the client and they can also better manage the information that they get from the client. In the 1980s, nursing informatics emerged. So, need of data standards, vocabularies, and classification scheme for computer-based patient record or CPRs, which is an EHR identified or electronic health record. So during this time, since the computer is all since computers are always used, so they have to develop vocabularies or record system to be used in the electronic health record. So they need to standardize their data and vocabularies. So microcomputer or personal computer emerges. So it has brought computing power to the workplace, especially to the point of care. Serve as standalone system at the workstation, user-friendly and allow nurses to create their own application. So now we have microcomputers or personal computer that are used in the care of patients. We have the hospital information system emerged with nursing subsystems. So the information system is now focused on nursing subsystems like order entry like Cardex. So there's a program now that helps in keeping track of the patient. We all know that we have a Cardex as a paper Cardex, and we also have a computerized based Cardex. Okay, we have reporting results, vital signs, and narrative nursing notes. So all of this data can be now inputted or can be placed or can be presented in the computer. So like the Cardex, you can put the information of the patient, for example, Perkins Carl patient, and the results of the laboratory, what is the vital signs. So all this information can be now placed in the computer, okay, using the Cardex, computerized Cardex. In the 1990s, computer technology became an integral part of healthcare setting, nursing practice, and the profession. Nursing informatics was approved in 1992 by the American Nurses Association as a new nursing specialty. Demand for nursing informatics expertise increased greatly. So, in 1992, they already identified nursing informatics, and since then, there is now great demand for this expertise. So, use of innovative technologies for all level and type of nursing and patient education are demanded. So many technologies now in the 1990s are used to take care of patients. So laptops and notebooks were utilized at the bedside and all points of care setting. So it is used for managing data and recording data also to take care of the patient. LAN were developed in hospital or local area network. This is to facilitate the transfer of data. We have wide area network were developed for linking care across healthcare facilities. Internet is also used to help information and knowledge database to integrated into bedside systems. In 1995, internet was brought to social milieu, email, and file transport protocol, upload and download. So the internet was used to exchange data between the CPRS or the computerized patient record system, while the web became the means to communicate online service and resources to the nursing community. So at this time, computers or the internet is used. So not only uh, the computers or the health information system is not only focused in the hospital, but it became accessible. So it became global with the internet. So you can upload and download data. So send information in the email, provide information, and receive information through email and file transport using the internet. Post 2000, development of wireless point of care system with a focus on open source solution. So we have clinical information system become individualized in the electronic patient record and patient specific system considered for lifelong longitude record or the HER. Okay, so with this mobile technology advances, we have wireless tablet computers, PDA or the personal device assistant. We have smartphones. We have VoIP or the Voice over Internet Protocol, health smart cards. Then telenursing became popular for remote monitoring of ICU patient and community patients. So with this technology, we can now monitor clients. So even if they are not at your side, for example, in the ICU, using a telemetry device, so we can monitor the heart rate of the client even if the patient is in the other station. So we also have the health card as example here. So it provides variable data for the client. So for us, we are now using smartphones. So in our smartphones, we have different apps we can use. So we have tracking apps, we have information apps that we need, drug handbook apps. So a lot of information used for patient care. So these are the references for this presentation. So especially nursing informatics historical perspective retrieved from SlideShare. And also we have computer and nursing and computer system retrieved from SlideShare. So that's it for this presentation. Thank you. Always stay interested. I'm that Pinoy nurse and God bless.